Often patients come with certain symptoms like pain or bloating sensation in the abdomen or some headache, which really doesn't have a medical explanation. They spend a lot of time going to various doctors. Sometimes they are satisfied, sometimes very commonly they are dissatisfied with doctor explanations, because the doctors just tap them on their shoulder, tell them, look, all your tests are okay, everything is all right, there's nothing to worry. But they have dysfunction, they're not able to work, they're not able to take care of their family, and very commonly in such individuals they are referred for psychological evaluation. Now when these people are evaluated, we have found that about 40 to 50% of them have depression or anxiety. And this is one of the ways in which depression can manifest, through somatic symptoms, through physical symptoms. And that's something cultural, because in the Indian context, people are not really psychologically oriented. So they don't really come and tell you that I'm feeling sad, I'm feeling low. But on the other hand, they prefer to somatize it. Something is not right with my body. I'm feeling really tired these days. It's paining me. So when these symptoms come, we have to be alert to the possibility that this may be a proxy for depression. If depression or anxiety is diagnosed, that's eminently treatable. So that's something that we can always remember. If there is no depression or anxiety, still there are options for managing that condition. In such cases, what we can tell the patients is how to live with that condition better. Make it very clear that having a symptom doesn't mean that there is a disease in your body. Symptoms do not equate to disease. There can be certain symptoms in some people. For example, I think we all appreciate that some individuals have a lower pain threshold, whereas some individuals have a higher pain threshold. Similarly, some people are tall, some people are short, some people are fat, some people are thin. So there are lots of individual variations in physiological parameters across our own culture. So we have to appreciate that and tell them that we acknowledge the reality of the symptom. We are in no way telling that you are fabricating the symptom. It's genuine. We appreciate that. But there are a lot of things in your control that you can do to circumvent the dysfunction that the symptom is causing you. People often complain of pain and just confine themselves to the bed. Simple things like aerobic exercise has been known to beat pain. Just simple half an hour of walking, brisk walking, is known to reduce pain, because exercise releases a lot of endogenous opioids in the brain, which are our body's own intrinsic analgesics. So they play the role of analgesics. They give you adequate pain relief. So that's one strategy that has been really evidence-based for the management of a lot of these conditions. So simple strategies like putting an activity schedule in place. They have become dysfunctional, but if you tell them how to get back to work in a graded manner. Now suppose a patient is bedridden. All of a sudden you ask him, okay, from tomorrow you go and work 8 hours a day. Now that's too overwhelming for somebody. But if I tell him, okay, tomorrow why don't you just go to your work for 20 minutes and then you come back and tell me your experience. Many a times people have come back and told me that it was not so bad. I thought I would not be able to survive at all, but 20 minutes doesn't look too bad at all. Okay, then why don't we do it 20 minutes this week and maybe an hour next week? Similarly, so some kind of a graded pattern of return to work, if people are advised, they feel less overwhelmed, they feel better able to cope up with it, and they're more likely to come back and give you positive experiences. So I think what's most important is looking for any treatable psychological morbidity in these individuals like depression or anxiety. Secondly, to emphasize to the patient that we must learn to live with the symptom rather than looking for a cure, going to doctors and doctors doing more tests. And I really cannot overemphasize the intrinsic harm, that is inherent in doing multiple tests. Any test has a 5% chance of false positives. The more the tests, the more the likelihood of false positives. So don't get into that rut of too much consultations and too much tests and complicate the issue. Keep things simple. Do simple things like exercise, graded pattern of return to work, activity scheduling, and that's one way you can deal with these symptoms.